as we're going. If we don't get to them right during the presentation, we'll have a question and answer period afterwards as well. So anything that comes up, or that you're thinking about, please feel free to type those in the chat as we go through. You can go to the next slide. Okay, so we're going to touch on some general information. And I know we do have some participants today from states outside of our area, which is great. Every state does tend to have a sort of their own system of care, and to some extent for children and adults. There are definitely some similarities, but some of the specifics will vary a little bit based on state and sometimes even county or area or region that you live in. Many of the services that might be available for autistic individuals, particularly as they move into adulthood, are going to be funded through Medicaid. And we'll talk about that in terms of Medicaid providing health insurance, but also Medicaid in terms of those waivers and being an additional funding source. So we'll talk about both of those things today. Sorry, back for 1 second. So we will go through Pennsylvania and New Jersey in our sort of area a little more detailed, but again, all states are going to have some similar systems in place, and we can talk about, sort of ways you might try to find some of that information. And so not to say that any state is necessarily better or worse in terms of what's offered, they just do vary, and knowing how the systems work and where you live is really important. Go ahead. So Medicaid and waivers. So Medicaid is a joint federal and state program. So, federally, there's some guidelines around Medicaid, and then states get funding through that system, and they have some leeway or some discretion in how they decide to use that funding. And so Medicaid does provide health coverage, and nationally, this is really based on usually on financial guidelines or disability qualifications, and then sometimes age is related as well. But this can provide health coverage, and we'll talk again about Pennsylvania has a little bit of a different program in place with Medicaid, but it can cover behavioral health as well as medical health needs. Eligibility will vary state by state. So like we sort of just said, in some states, it's really going to be more financially or income driven. Other states like Pennsylvania, we have some unique supports in place that are going to be based on children with qualifying disabilities. Go ahead. Then a waiver. So the Medicaid waiver is a little different. It's still funding through the Medicaid system, but this is going to provide not just health insurance, but actually funding for different programs and supports and services that individuals might need. And I always I thought it was interesting kind of learning where the term waiver came from. So really, this was, many years ago when there was a push for deinstitutionalization, the term waiver really applied to families saying, we're waiving our right to have our loved one in an institution. We want to keep them in the community. And so having a waiver means you're going to have funding to try to provide support in the least restrictive setting in the community that makes sense for that individual. The waivers for individuals with autism generally are going to be more for adult related services, because most states have, they're going to have special education service through the public school system, and they're going to have often behavioral health programs that are available for children, but that's not always the case. There are states that also have waivers that are available for children or that are mainly meant for children. So all waivers are going to be both eligibility based and needs based. So looking at, do you meet the criteria for this waiver, which we'll touch on a little bit, and also sort of what is the level of need. So somebody who perhaps doesn't have a caregiver anymore or doesn't have a safe place to live, they may get priority in accessing waiver funding over somebody who does have a really supportive setting that they're already living in. I'm going to pause here because I see we do have a question in the chat. Okay, so this is somebody who is in the United States with a working visa. Son has insurance coverage through the employer, but no social security number. Would Medicaid still be available? So in Pennsylvania, I have had experience with children whose families were in the country through work visa, because in one particular specific case I can think of, this child had both complex medical needs as well as autism and an intellectual disability. And so we worked with Disability Rights of Pennsylvania and the Health Law Project, which are both state organizations, and most states will have a comparable kind of organization. And we worked with them, and we were able to get medical assistance put in place for this child. Because, we made the argument, in terms of the services that he needed to access, and not having, he wasn't a citizen, but he needed those services in addition to his public school service that he was getting. And we were able to get that in place for him. So I think it's probably a little bit of a case-by-case situation and needing to work with someone to help advocate and sort of help you work through the system, but that is a possibility, yes. Okay, we can go to the next slide. So specific to Pennsylvania, I mentioned that our Medicaid as an insurance is a little different than what we see in a lot of other states. And we refer to this as medical assistance. That's the same as saying Medicaid. That's just sort of what the program in Pennsylvania is called. So this is a medical insurance program. And in Pennsylvania, this could be a child's primary insurance, or it can be a supplement to the private insurance or a secondary insurance. And Pennsylvania has decided that this is something that should be an entitlement for all children with a qualifying disability. So you do have to show sort of documentation that your child has a disability that meets these criteria, and you do have to continue to verify eligibility. It used to be annually, then we had switched to being able to do it at every, I think, 3 to 5 years. So it may vary a little bit, but you do have to continually sort of re-verify. You don't have to go through the full application process. And so children with autism or other potentially qualifying diagnoses can access this medical assistance as a supplemental health insurance under what Pennsylvania has called PH 95, which is just the sort of legal precedent for that. In addition, I want to just touch on SSI because this is something that families often have questions about. So supplemental security income is a federal program, and this is actually going to provide some monetary assistance to help cover the cost of different services in addition to health insurance. SSI is going to be income-based, both for children and for those over 18 who might qualify. So in this case, you have to have a disability that meets criteria as well as meeting the income or financially based guidelines. But if somebody is eligible for SSI, they're automatically going to get medical assistance as well. So some counties in Pennsylvania will want families to apply for SSI first. And if they get denied based on income, then apply just for medical assistance, because of this idea that if they qualify for SSI, they're going to automatically get the medical assistance. So that's something, depending on where you live in Pennsylvania, that you'll want to find out sort of how your county manages that. And so what are some of the things that could be covered in Pennsylvania through medical assistance? And this is a very non-exhaustive list, but I like to sort of highlight that there are a lot of different supports and services that might be offered or available that families don't always know about. One of the biggest ones is ABA services, or we call that IBHS, which is Intensive Behavioral Health Services. So under that sort of medical assistance funded umbrella, that's the term that you're going to be hearing. And that can provide different levels of behavioral support, both in the home, in the community, at school, depending on what's sort of deemed as the level of support for each individual child. And families can access those services if they have the medical assistance as a secondary insurance. Then they're going to be working with 2 different insurance plans to help provide the coverage, but that's an option as well. Sometimes, we were talking about in the case today that this particular little boy isn't toilet trained yet. We do see sometimes that autistic children might be a little later for toilet training, and at a certain point, I don't think 3 would qualify, but for slightly older children who might still be working on that skill, medical assistance might cover the cost of some of the diapers or pull-ups for them. We have some children who might need the support of a home health aide or maybe a communication device. And so medical assistance is a way that families can really help cover and supplement the cost for some of these various different activities. And then the last thing I put on here, the access community activities, is something that a lot of families don't even actually know is available. But when you have that medical assistance card within Pennsylvania, and particularly in the Philadelphia area, there are lots of local organizations that are part of the Access program and will offer really discounted tickets for families to do different social outings in the community, often at like $2 to $5 a ticket, which is a huge discount from some of the regular costs. So that's something that is available to families as well. So this slide is sort of just showing two of the main ways in Pennsylvania families might apply for medical assistance. There is an online portal through Compass, which is actually the way to apply for any benefits through the state. And then there's still a paper application that's available too. But typically, I encourage families to contact their local county assistance office for where they live to sort of find out what's the preferred method for us to apply in our county. What are some of the different, documentation that you're going to need to make sure that they have everything they need to go through that process. And then in Pennsylvania, these are 3 resources that might be helpful. The Pennsylvania Health Law Project, I mentioned, I think, a little bit earlier. So this is an organization specifically focused on providing health insurance for all qualifying children, specifically in Pennsylvania, helping families get access to medical assistance when they meet those qualifying criteria. And then Children First also is a place that families can call to get support in sort of going through the application process. So these are all good resources. So in New Jersey, because I know we have some New Jersey families too, the name of the Medicaid program in New Jersey is New Jersey Family Care. And this would include both CHIP, so sort of that like state provided health insurance for children, as well as Medicaid, which is going to have more eligibility criteria. But the difference is that in New Jersey, that is going to be an income-based program. So just having a qualifying disability is not going to make someone eligible for Medicaid in New Jersey. However, if a child has a significant medical need as well as other qualifying disabilities, there is a medically needy program in New Jersey that you might be eligible for with kind of the high support needs of specific individuals. New Jersey does have something called Perform Care. So as I mentioned before, most states have some system in place to provide behavioral health services to children. So, Pennsylvania, as we talked about, through medical assistance. In New Jersey, Perform Care is sort of New Jersey's children's system of care. This has both behavioral health and a developmental disabilities component to it. So an individual may qualify under both of those categories or under one or the other. So families can contact Perform Care and go through the eligibility process to determine if their child might be eligible. And even if they decide not to use those services, I definitely encourage families to make that connection to find out what might be available, what kinds of supports, because this is going to be the system of care that will offer some of the in-home supports, parent coaching, respite care, other supplemental services that might not be available through traditional health insurance. And so this is going back to what Judy was mentioning at the end of our case. So state mandated coverage. And at this point, all states have taken some action toward requiring coverage for autism specific services, including ABA. So what this basically says is that if you're getting health insurance through your employer, unless you work for a very small business, usually it's any company over 50 employees is going to be required to meet whatever the state's specific kind of guidelines are. And those health insurance plans have to offer some type of autism benefit. And so the best advice here is to call and speak to a care manager with your individual specific plan. And as Judy mentioned, a lot of plans now have even a specific autism kind of case manager or advisor. So you can ask about whether that's available, and they'll really understand the way this benefit's going to be implemented for your specific plan. And the reason why it's really important to get that information is that this is still, an insurance benefit. And so just as you might have a copay when you go to see a specialty care doctor, there's likely going to be some types of copay or deductible associated with those autism services. But the benefit is that you'll have some additional funding available. There may not be caps on some of those related services like occupational therapy and speech therapy. You may not have limited sessions for those things. the key here is that we're saying these are services that are specifically working on some of the symptoms of autism. So where this can get a little tricky is that a child maybe who needs outpatient therapy because they're really anxious and also have autism, those kinds of services, they may not fall under this benefit, because there we might say, well, this is a service for their anxiety. This is not directly addressing the symptoms of autism. And so it's important to really get a good understanding of what your particular plan is going to offer and how you're going to be able to use that to access services. And that would be true this is true for any state. You know, you'll want to call and really get some good detailed information. So this is, I sort of went over some of this already. So the last bullet here, we didn't really talk about, but this is a Pennsylvania question that does come up often, is what happens if families have both that private insurance and medical assistance as a supplemental insurance. And so it's really important in that case that they find providers that are going to accept both plans. And this can be a little bit of a barrier in some cases as you're sort of getting started, but generally once you have services in place, this is really a benefit, because that medical assistance will cover any of those extra costs that we were talking about may go along with the benefits. So co-pays, deductibles, other things like that. So when a family has both commercial and medical assistance in Pennsylvania, it's very important to get a list of kind of both sets of in-network providers. What will happen is that any provider is going to typically bill the commercial insurance first, because they usually get a slightly higher reimbursement rate, and then medical assistance is going to kind of kick in to pick up what's left. So this can be frustrating. You know, if you found a provider you really like or that you've worked with and they only take one or the other, it is going to be important to try to find somebody that's going to be in network for both plans. And then